Which needle gauge is most suitable for drawing blood from a patient with small, fragile veins? A. 16 gauge. B. 21 gauge. C. 23 gauge. D. 18 gauge. Answer: C. 23 gauge. A 23 gauge needle is smaller in diameter, making it ideal for patients with small or fragile veins. Larger needles, e.g., 16G or 18G, can cause vein damage or hemolysis, while a 21 gauge needle is more commonly used for standard venipuncture. What is the first step in patient identification? A. Ask the patient to state their name and date of birth. B. Verify the name on the requisition form matches their ID. C. Check the room number. D. Confirm the test order with the nurse. Answer: A. Ask the patient to state their name and date of birth. Proper patient identification is critical to avoid errors. The phlebotomist should always ask the patient to verbally state their full name and date of birth, then cross-check this information with the requisition form and their ID bracelet or other official documents. Which action violates HIPAA compliance? A. Discussing results in a private area. B. Sharing patient data with unauthorized family. C. Documenting in the EHR. D. Using ID bands for verification. Answer: B. Sharing patient data with unauthorized family. HIPAA, Health Insurance Portability and Accountability Act, protects patient privacy. Sharing patient information with unauthorized individuals, even family members, without the patient's consent is a violation. Discussing results privately and documenting in the EHR are compliant practices. A patient faints during venipuncture. What should the phlebotomist do first? A. Continue the draw quickly. B. Remove the needle and lower the patient's head. C. Call 911. D. Offer water. Answer: B. Remove the needle and lower the patient's head. If a patient faints, the phlebotomist should immediately stop the procedure, remove the needle, and position the patient safely, e.g., lower their head to improve blood flow to the brain. Calling 911 may be necessary if the patient does not recover quickly. Which tube is used for coagulation studies? A. Lavender top. B. Light blue top. C. Green top. D. Red top. Answer: B. Light blue top. Light blue top tubes contain sodium citrate, which prevents blood from clotting by binding calcium. These tubes are specifically used for coagulation tests like PT, prothrombin time, and INR, International Normalized Ratio. What is the correct order of draw for vacuum tubes? A. EDTA, serum, heparin, citrate. B. Citrate, serum, heparin, EDTA. C. Heparin, citrate, serum, EDTA. D. Serum, citrate, heparin, EDTA. Answer: B. Citrate, serum, heparin, EDTA. The correct order of draw is citrate, light blue top, coagulation studies. Serum, red or gold top, chemistry tests. Heparin, green top, plasma chemistry. EDTA, lavender top, hematology. This order prevents cross-contamination of additives between tubes. When should a phlebotomist replace gloves? A. After each patient. B. When gloves are visibly soiled. C. At the end of the shift. D. Both A and B. Answer: D. Both A and B. Gloves must be changed between patients to prevent cross-contamination. They should also be replaced immediately if they become visibly soiled or torn during a procedure. Reusing gloves or waiting until the end of the shift is unsafe and violates infection control protocols. Which of the following is a biohazard? A. Used gloves. B. Empty specimen bags. C. Contaminated gauze. D. All of the above. Answer: D. All of the above. Any item that has come into contact with blood or body fluids is considered a biohazard and must be disposed of in a biohazard waste container. This includes used gloves, contaminated gauze, and even empty specimen bags that may have residual contamination. What is the maximum time a tourniquet should be left on? A. 30 seconds. B. 1 minute. C. 2 minutes. D. 5 minutes. Answer: B. 1 minute. Leaving a tourniquet on for more than 1 minute can cause hemoconcentration, thickening of the blood, and alter test results. It can also cause discomfort or nerve damage to the patient. Which action prevents hemolysis? A. Shaking tubes vigorously. B. Using a small needle. C. Inverting anticoagulant tubes gently. D. Drawing from a hematoma. Answer: C. Inverting anticoagulant tubes gently. Hemolysis, rupture of red blood cells, can occur if blood samples are handled roughly. To prevent this, tubes with anticoagulants should be gently inverted 5 to 10 times to mix the blood with the additive. Shaking tubes vigorously or using improper techniques can cause hemolysis, which may invalidate test results. A patient refuses a blood draw. The phlebotomist should: A. Proceed as ordered. B. Document the refusal and notify the supervisor. C. Convince the patient. D. Restrain the patient. Answer: B. Document the refusal and notify the supervisor. Patients have the right to refuse any medical procedure. The phlebotomist must respect this decision, document the refusal in the patient's record, and inform the ordering physician or supervisor. Attempting to convince or restrain the patient is unethical and could lead to legal consequences. Which PP is required for routine venipuncture? A. Gloves and gown. B. Gloves only. C. Face shield. D. N95 mask. Answer: B. Gloves only. For routine venipuncture, gloves are the minimum required PP to protect against blood-borne pathogens. Additional PP, such as gowns, face shields, or N95 masks, is only necessary when there is a risk of splashes or exposure to airborne pathogens. What is the purpose of inverting EDTA tubes? A. Prevent clotting. B. Mix blood with additives. C. Preserve cell morphology. D. Enhance serum separation. Answer: B. Mix blood with additives. EDTA tubes contain an anticoagulant that prevents blood from clotting. Inverting the tube gently ensures that the blood mixes thoroughly with the additive, which is essential for accurate hematology tests like CBC, complete blood count. Which test is affected by improper patient fasting? A. CBC. B. Glucose. C. Point/INR. D. Electrolytes. Answer: B. Glucose. Fasting is required for accurate glucose testing because eating can temporarily raise blood sugar levels. Tests like CBC, PT/INR, and electrolytes are not affected by fasting. A patient has a latex allergy. Which item should be avoided? A. Plastic tourniquet. B. Latex gloves. C. Alcohol swabs. D. Cotton balls. Answer: B. Latex gloves. Patients with latex allergies can have severe reactions to latex-containing products. Phlebotomists should use nitrile gloves and ensure all equipment, e.g., tourniquets, is latex-free. What is the role of a phlebotomist during a needle stick injury? A. Hide the incident. B. Wash the site and report immediately. C. Continue working. D. Dispose of the needle secretly. Answer: B. Wash the site and report immediately. If a needle stick injury occurs, the phlebotomist should immediately wash the site with soap and water, then report the incident to their supervisor. Proper documentation and follow-up, e.g., testing for blood-borne pathogens, are essential to ensure safety and compliance with OSHA regulations. Which tube is collected first in a blood culture draw? A. Light blue top. B. Yellow top. C. Lavender top. D. Red top. Answer B. Yellow top. Blood culture bottles, yellow top, are always drawn first to prevent contamination from other tubes. This ensures accurate results for detecting infections. What should a phlebotomist do if a patient has a seizure during a draw? A. Restrain the patient. B. Remove the needle and call for help. C. Continue the draw. D. Offer food. Answer B. Remove the needle and call for help. If a patient has a seizure, the phlebotomist should immediately stop the procedure, remove the needle, and call for medical assistance. Restraining the patient or continuing the draw could cause harm. Which vein is most commonly used for venipuncture? A. Basilic. B. Cephalic. C. Median cubital. D. Dorsal hand. Answer C. Median cubital. The median cubital vein is the first choice for venipuncture because it is large, well-anchored, and less painful for the patient. The basilic and cephalic veins are secondary options, while dorsal hand veins are used only when necessary. What is the purpose of a gray top tube? A. Coagulation studies. B. Glucose testing. C. Hematology tests. D. Serum separation. Answer B. Glucose testing. Gray top tubes contain sodium fluoride, which preserves glucose levels by inhibiting glycolysis. They are used for glucose and lactate tests. Which of the following is a proper hand-washing technique? A. Rinse hands under cold water. B. Use hand sanitizer instead of soap. C. Scrub hands for at least 20 seconds. D. Dry hands on an apron. Answer C. Scrub hands for at least 20 seconds. Proper hand washing involves scrubbing with soap and water for at least 20 seconds, ensuring all surfaces of the hands are cleaned. Hand sanitizer is not a substitute for hand washing when hands are visibly soiled. What is the minimum internal cooking temperature for injected meats? A. 135 degrees Fahrenheit. B. 145 degrees Fahrenheit. C. 155 degrees Fahrenheit. D. 165 degrees Fahrenheit. Answer C. 155 degrees Fahrenheit. Injected meats must be cooked to a minimum internal temperature of 155 degrees Fahrenheit to ensure safety. What is the proper way to clean and sanitize a cutting board? A. Rinse with water. B. Wash with soap and water, then sanitize. C. Wipe with a cloth. D. Use hand sanitizer. Answer B. Wash with soap and water, then sanitize. Cutting boards must be washed with soap and water, then sanitized to prevent cross-contamination. What is the minimum internal cooking temperature for stuffed pasta? A. 135 degrees Fahrenheit. B. 145 degrees Fahrenheit. C. 155 degrees Fahrenheit. D. 165 degrees Fahrenheit. Answer D. 165 degrees Fahrenheit. Stuffed pasta must be cooked to a minimum internal temperature of 165 degrees Fahrenheit. What is the proper way to store chemicals in a kitchen? A. Next to food supplies. B. In a designated area away from food. C. On the counter for easy access. D. In the refrigerator. Answer B. In a designated area away from food. Chemicals should be stored in a designated area away from food to prevent contamination. What is the minimum internal cooking temperature for roasts? A. 135 degrees Fahrenheit. B. 145 degrees Fahrenheit. C. 155 degrees Fahrenheit. D. 165 degrees Fahrenheit. Answer A. 135 degrees Fahrenheit. Roasts must be cooked to a minimum internal temperature of 135 degrees Fahrenheit. What is the proper way to handle a food recall? A. Ignore the recall notice. B. Remove the recalled product from inventory. C. Continue selling the recalled product. D. Dispose of all food in the kitchen. Answer B. Remove the recalled product from inventory. Recalled products must be removed from inventory immediately. What is the minimum internal cooking temperature for injected meats? A. 135 degrees Fahrenheit. B. 145 degrees Fahrenheit. C. 155 degrees Fahrenheit. D. 165 degrees Fahrenheit. Answer C. 155 degrees Fahrenheit. Injected meats must be cooked to a minimum internal temperature of 155 degrees Fahrenheit. What is the proper way to store ice in a kitchen? A. In a container with food. B. In a designated ice storage bin. C. On the counter. D. In the freezer door. Answer B. In a designated ice storage bin. Ice should be stored in a designated bin to prevent contamination. What is the minimum internal cooking temperature for microwaved food? A. 135 degrees Fahrenheit. B. 145 degrees Fahrenheit. C. 155 degrees Fahrenheit. D. 165 degrees Fahrenheit. Answer D. 165 degrees Fahrenheit. Microwaved food must reach a minimum internal temperature of 165 degrees Fahrenheit.